Does the etiology of bladder cancer, in terms of how somebody really developed it, you mentioned the long lead time from exposure to actual diagnosis, but does it make a difference in regard to disease progression? Is there anything you might know about that?
No, usually not. So the latent period is in terms of the development of the cancer in the first place. And that's what I was referring to, is bladder cancer can have an extremely long time from first exposure to the bladder carcinogen to the diagnosis of the disease. But in terms of prognosis, no, I've never really seen any research that even looked at that, addressed that in humans, that is. So I don't think that's hasn't been a concern.
An individual is wondering about spring water from New England regarding the arsenic issue, and I think they're probably referring to bottled water. So can you talk a little bit about how that's evaluated and tested, and if it's said to come from the New England area, is that a good thing? Are they screening out and the arsenic? Can you talk about that?
Well, this study, as I mentioned, was people who were diagnosed from 2001 to 2004. And when we asked them about their history of bottled water use, it was before bottled water really became popular. And so bottled water use in that study was very low. And so we were not really able to look into these issues. Now, we did ask about getting water from a spring, but again, the spring water source was, few people were doing that, and so it was difficult. We did not identify any specific risk, but very few people reported drinking their water from the spring. Some did, but it was small numbers, and so we couldn't really say definitively about spring water or bottled water per se. But supposedly drinking water, that bottled water that does not contain contaminants, should be a good thing. So it's drinking water that contains arsenic or high levels of DBPs, perhaps even nitrates, that I'd be worried about.
Okay, thank you. Lynn, do you have anything to add about that?
No, I think that was very helpful. And we tend to ask people to avoid bottled water unless they really need it, because there's no other source of water, just because it's, costs so much more than tap water if you have tap water. And it's, of course, all the waste and plastics are of concern. And but it is true that over the last couple decades, bottled water in general that's sold in this country has to meet at least the minimum Safe Drinking Water Act standards for most contaminants. That did not used to be true, but it is not. We don't find its quality is necessarily better. In fact, usually not. Sometimes it can taste better because they basically take tap water and just add some more treatment to it. So.
There's been a lot of attention recently to PFAS in drinking water in southern Michigan, a high rate in the area. Do we have relevant data yet, specifically looking at cancer incidents? So, Dr. Silverman, I guess this would be a question for you.
Well, I'm not familiar with any cancer data related to that yet. Now, remembering cancer's got a long latency, but in general, but I'm not familiar with it, and it hasn't really been a bladder cancer issue. And that's more my area of expertise.
Well, here's a really interesting question, and it's specifically, I think, looking at some of your data that you presented, Dr. Silverman, do your numbers of incidents factor in population migration? For example, this individual worked in chemical plastics rubber industry in Ohio for 10 years, and 30 years later, he was diagnosed with bladder cancer in Tennessee.
Well, it depends on the epidemiologic study. A well-designed study would definitely pick that up. And now that I believe almost every state in the United States has a cancer registry, it's much easier to do these studies. So when people leave as in the example, to move to a different state, they can still be identified. But again, it depends on the study. A good study would catch that person. And for mortality studies, they're definitely caught in the National Death Index. So, studies of the future for incidents will be better than the past because of the national cancer registries in every state.
Thank you. Here's a question from one of our patients. It's very interesting information that you're presenting, and she's a little bit confused about bromating agents. I use bromide tablets in the spa. Is it risky only if it's ingested? So I guess she's using it in her whirlpool or in her spa and wanted to know if it was an increased risk unless it's ingested.
But we were thinking of doing a study in hot tubs that did just that to answer her question. So it is common what she does, and we don't know the answer. But it's always good to err on the safe side. So not based on real data, but perhaps there were better ways than using the brominated compounds.
What about consumption or exposure to water contaminated with impossible subsequent infection with schistosomiasis in terms of people who are internationally? I don't know if you're, tuned into
yes.
Dr.
Well, schistosomiasis causes bladder cancer in countries like Egypt, where it's prevalent, and it turns out that it's a different type of bladder cancer from what we see common in the U.S. and in Western Europe, and that is it's squamous cell carcinoma, whereas we see a lot of urothelial carcinoma in this country. It's a different type of bladder cancer. But as schistosomiasis has come under better control in countries like Egypt, there's actually been a shift in the type of bladder cancer from originally it was more squamous cell of the bladder, and now they're seeing way more urothelial cell in Egypt. So that is changing. Have I given you I don't know if I've answered your question or not, but it's actually becoming less of a problem now because of the control of schistosomiasis.
Does a reverse osmosis system for well water help to remove enough contaminants?
It removes arsenic. That's a leading type of filter used when people have elevated arsenic. But people who have the filters, they have to be maintained on an annual basis. You can't just put them in and think they're going to work forever. So they do require annual maintenance, but reverse osmosis is a main way of filtering out arsenic.
You may or may not know anything about exposure risks for people in the dental industry. An individual reports that they got bladder cancer after 40 years of practice. They never smoked, but they used acrylics and hydrocarbon as well as mercury. Do you have any indication of any of those things being contributing factors, risk factors?
I've never seen dentists come up in all the years of studies, but it's certainly plausible, but it wouldn't be based on any data. I don't know of any data that really answer that question.
Right.
But
Okay.
could be plausible.
There are bladder cancer hotspots on the West Coast, Midwest, and Louisiana. The similarity related to public and private well use. Is there any data on suppliers in these regions or exposure to contaminants specific to these little hotspot areas? I know that you had some of them were identified on your map earlier.
Well, the California area, there are a lot of private wells. The USGS put out a publication estimating that 2.1 million people in the U.S. are drinking from wells high with elevated levels of arsenic. And they have a map that I'm looking at, and California is definitely a part of this. And you do see some things in the Louisiana area as well, and also in Florida. I don't remember what other states did you mention?
Louisiana was one of them.
Yeah.
Midwest.
Yeah, there are wells with elevated levels of arsenic above the 10 microgram per liter regular limit. In all of these areas. So this is potentially a bigger problem than people realize.
If you could just maybe kind of close down a little bit about secondhand smoke. You talked about smoking at the beginning of the program, and speak a little bit about what we know about secondhand smoke, just to remind everybody about that, because that's always a big concern for people.
Well, the data are mixed. There are some positive studies and some null studies, and there haven't been many studies, just a few. So it's going to require additional research to really bring in a verdict on environmental tobacco smoke, is what I would say right now. The jury is still out.
I'd like to thank everybody again for a wonderful program.